Hi, this is Valerie Van Boeven. I'm a registered nurse and the co-owner of LTC Expert Publications. And today we're going to talk about online marketing for home health care in 2018, websites, visibility, authority, and leads. On our agenda today, the first thing we're going to talk about is websites, 2018 elements of a great lead generating website. Content, write it or buy it, but have it. Social media, all the accounts you don't need and the ones that make the most sense. Google and SEO for home healthcare agencies. E-newsletters, create it or buy it, but have it. And reputation, manage it. Managing and controlling your reputation. It is possible and it's worth it. Our objectives today: attendees will be able to write down 3 social media sites that are appropriate for home healthcare agencies. Attendees will be able to describe 2 advantages of monthly newsletters. Attendees will be able to describe 2 important aspects of managing online reputation, and which are reviews. Websites, 2018 elements of a great lead generating website. So I'm going to show you some screenshots of websites that we know across the board are really great at generating those home health care leads. Some of these companies are private duty, some of them are home health care, and some of them are websites that we created at LTC Expert Publications, and some of them are just websites that we know are really great and meet all the requirements and have all the moving parts that we would want in a website. So the first one you see here is Provident Care, and they have a great lead generating website. And just want you to notice how clean, easy to navigate, how big the navigation is, and how you can absolutely tell where their service area is, you know what their phone number is, and there's no doubt in your mind that you know how to get a hold of these folks. This is one that we really like called Residential Home Health. They actually give away a home health care patient guide. Now this is an excellent way, this is their homepage, and this is an excellent way to get email addresses and get folks information so that you can send them a monthly newsletter, which we'll talk about in a little while. But again, this website is very clean. It's easy to read. Their phone number is right at the top. There's no doubt about how to get a hold of them or what you should be doing. And I think this is great that they're giving away a guide that helps patients understand the support that home health provides, probably the types of care and how it's paid for. This is a hospice website. Again, very clean, very easy. This one is, very calming. Its colors are calm. And I think my screenshot's a little small because the navigation is a little smaller on this one. But it does answer a lot of questions. Why hospice? When is hospice right? Community services. And it really gives some good information. So educating people about hospice care is very important, of course. And this website does the trick. And start here to find care near you. You see that right in the middle of the screen there under Welcome to Serenity Hospice Care. If you were to click on that, it would drop down and you would be able to see all the different areas they service in around their offices. This is one of our best lead generating websites, and I'm not sure what to attribute that to because it has the same elements of a great website, which are that it's mobile responsive. It has, at the top you can tell exactly where they service. You can see their phone number. I think it may have to do with some of the graphics, the pictures, and Family First Home Companions does get a lot of leads from this website. Again, the same rules apply. Very clean, easy to navigate. This is Devoted Guardians. They are out of Phoenix, and they actually had some more messaging that they wanted on their site. But you can tell again, there's the same kind of a theme running through all these websites, and that is that the phone number is very prevalent. 90% of the people who come to your website who need care are probably going to pick up the phone and call because they need to talk to somebody. And then 10% of the people that come to your site are probably going to fill out a form. So it's important that your phone numbers are easy to read and easy to find. There is a book called Don't Make Me Think. It's written for web developers, but it really goes into some great detail about creating websites that help people do exactly what you want them to do. So the calls to action are right there. Call today. Find devoted guardians home care in your area. Get started. Those kinds of things are so important. When you're overwhelmed and you're stressed out, you don't want to have to think about all that stuff. So having those calls to action very prominent is super important. Another website I really like, and this one also is easy to navigate, easy to figure out, that's Tenderhearted Home Care. Affordable caring in-home living assistance for seniors in the Piedmont area of North Carolina with our phone number. If you were to click on Find Tenderhearted Home Care in your community, you'd see a list of drop-downs. For family members, our services, and get started. Super easy stuff. This is Tender Rose Home Care. They are out of California, and they specialize in dementia. In fact, I think that's all they take are dementia clients. So they have a specialty. They're very clear about that. Their homepage is easy to navigate, and Contact Us Today is right there at the top. So there's no doubt about how to get a hold of these folks. So I talked about this a minute ago, but the reality is that when an adult child of an aging parent is trying to navigate the healthcare system, they're already instantly burned out and overwhelmed and stressed out about the whole thing. So solve their problem and don't make them think. So solve my problem. Can you help me? I have an elder care issue. And don't make me think. Don't make me struggle to find your phone number at the very bottom of the homepage or only on the Contact Us page. Put that baby right up there at the top. And as far as your service area goes, if I live in West Winnemucca, Nevada, and my parents are in Pennsylvania, I may not know all the different service areas in Pennsylvania if I didn't grow up there. So having your service areas clearly defined on the home page above the scroll line is a nice thing to do. So consider your audience. They're not always web savvy. Even if you are, your clients may not be web savvy at all, especially of certain generations. They may be okay with it, but they may not be really web savvy. And they're definitely probably not home care savvy. They are not home health care savvy. They haven't, they don't know what an ADL is. They don't talk the talk. They don't walk the walk. This is new for them. And of course, it's very stressful and it's very frightening when someone is suddenly put in a position where they're going to need some kind of care, maybe long-term care, maybe short-term care. But whatever the case may be, we have illness and we have folks that are needing follow-up at home, which it can be distressing. So the easier your website is to navigate, the better off you'll be. So calls to action. I talked about this a little bit. You definitely want to make sure you have a phone number there. They're only going to call or fill out a form. We use the words get started a lot on our websites because that tends to make the most sense to a lot of people. Get started. So calling and filling out the form, those are the only two things you really care about with regards to your website. So you need to make sure that that phone call, they can click on it, that it's on a mobile device, that it's clickable, and filling out a form is easy. And we actually use long forms on our websites to eliminate or reduce the amount of spam and solicitations. And the words get started really do help people understand that they can click there and they can start down the path of understanding more. So here this just points out, this slide will point out some of the calls to action and the don't make me think properties of our websites. So you can just see up there, clear, easy to understand, short messages, get started, find senior care in your community. Messages are short, simple, and to the point, and that's really how it needs to be. I see a lot of websites with these long dissertations about how we got into the business and what our history is, and you really don't need all that. Short, simple, and to the point is all you need. And here's a note, getting these arrows just point to these examples, how to get a hold of them, where to get a hold of them, what you need to do. It's easy and there is no confusion. This is the bottom of that same website, the Devoted Guardians website. So if the consumer does scroll down a little bit, you can just see that they expand on a few things. So we still have our get started or getting started, Alzheimer's and dementia care, caring for our caregivers, And then we have some more information about caregivers, specialty services, and testimonials. So you can get a little deeper as you go down scroll down the homepage, but above the scroll line, you want to keep it as simple as possible. This is the bottom of another website, that residential home health website. And I really like that as you scroll down, you come to this little video, and then you have these 4 avenues or 4 dots. Your physician prescribes home care, nurses and therapists come to your home, custom care plan helps you meet goals, and Medicare covers 100%. Very easy to read, very easy to understand, and you can watch the little video there if you want to see how that works. Is it all worth it? Getting your website in order, making sure it's up to date with 2018 requirements of Google, any requirements that you have from your federal or state. You may have some HIPAA laws that you need to follow more carefully depending on how your website is built. You definitely want to track everything that comes in from your website. If you haven't done that before, especially in home health, now in private duty, we harp on that all the time. They aren't going to know how their revenue is being generated if they don't track what's going on. But in home health care, you all know the importance of tracking things like readmission rates and diagnoses and all kinds of other goals and interventions and things like that. But what's important for the people in your office to know, someone needs to be responsible for tracking every form and every phone call that comes in through your website. So and when you do that, then it's much easier. It's not always black and white, but it's much easier to get a handle on how much revenue your website is generating for you, or how much potential it has to generate for you. I would say that for most home healthcare companies who do not invest and engage in their online marketing, they are probably leaving, 10 or 20% of additional revenue, from what they currently do to what they could be doing. They're leaving that on the table because they're not paying attention to their online marketing. It's so important to pay attention. And if you play your cards right, 1 new case or 2 new cases a year will cover a lot of that expense of keeping that website fresh, keeping new content on it, and all of that. Okay, let's talk content then. Write it or buy it, but have it. I think people get confused between what a website is and what a blog is, and they can be one and the same. So your website should have a blog on it, a way to add blog posts. So we use WordPress. Some of you may have an HTML built website. You may not even know what platform your website is built on, but WordPress makes it very easy for your staff or yourself or for a team that you hire to add content to it. So great content comes in many forms. But when we're talking about text in an article, this is what we're looking for: 400 to 500 words plus a photo or two. It has to be a unique article and not copied from others. It needs to be, of course, about home health care, elder care, senior care, pneumonia, COPD, wound care. It needs to be about things that are absolutely in your niche. It needs to be about your community and about your community involvement. So if you are out there, supporting a charity, or you sponsor an event, co-sponsor an event, or maybe you have Caregiver of the Month, maybe you have Employee of the Month, whatever you celebrate needs to first be put on your website as a blog post and then go out to all your social media. If you only post that stuff on Facebook, you are not giving your website the SEO, the search engine optimization, and the engagement that it needs to see from Google. So keep that in mind. You always want to post to your website and then take the URL of that post and put it out there on Facebook and Twitter and LinkedIn and all the other places. So this is just an example of some of the website content. So on the bottom of this is the very bottom of a website. And you can see on the right-hand side, you can see all of the blog posts that are coming in. They're search engine optimized. You can see that they have a place where you can read their testimonials, their social media, and they have, of course, a map of their location. This is the top of a blog post. So this is kind of what it would look like if you had a blog post on your website. You have your title, the date, the person who wrote the article, which is usually someone who is part of your company. And then, of course, your article itself. Now, on this website, we also have a contact us form right next to every single article or blog post that we put on the website. And the reason we do that is so if somebody just happens upon a COPD blog post, then they will always see ways to contact the home care agency or home health care agency. So they can see the toll-free phone number at the top, the service area at the top, and they can fill out a form if they don't want to call. Many times after hours, you're going to receive forms as opposed to phone calls. E-newsletter, create it or buy it, but definitely have it. So I always recommend that our home care agencies have a monthly newsletter. And a lot of folks will say, oh yeah, we have one, but we never send it out because, you know, we get busy and we forget about it. And then by the time we intended on sending out that February newsletter, it's now March and we have 10 people that need to decide what goes in it and all this crazy stuff. You need to simplify and set it and forget it is what you really need to do. So we set up newsletters that are completely automated. They go out every single month for our clients. They are based on the blog post. So let's go back. So this blog post would be, let's say it's February 5th, 2018. So what our system does is it takes all the brand new blog posts from the website and it creates little excerpts. So this article would end up in the newsletter that went out for February or for March, depending on the date it goes out, for that client. So we have all of the content that's on the website going straight into a newsletter system, and that newsletter system automatically sends out that newsletter. This helps avoid follow-up failure. I'll talk about that in a minute. You need to keep it automated and simple. It needs to be mobile responsive because everybody, and we've seen this in 10 years of collecting data and looking at these things, everybody who reads your newsletter is reading it on a mobile device. They are sitting at lunch. They are sitting in the bathroom. They are sitting in traffic. They are standing in line for something. And they are reading their emails, they're skimming through, they're in a hurry, but they have to wait for something. Maybe they're sitting in a doctor's office or whatever, and they read your e-newsletter. So they look at it, they open it up, they scroll through, and they hit the headlines with their eyes, and they see a headline that makes sense, and they click on that headline of that article, and they're taken right back to your mobile responsive website, and they read the entire article on your mobile responsive website. If you put long dissertations and all this pretty crazy stuff in newsletters, not only will it get stripped out by Gmail, Outlook, and many other even corporate email systems are going to strip out all the pictures and all that stuff. So you're going to end up sending them something that's only text anyway, but it needs to be mobile responsive. You need to keep the clutter down. Keep it very simple. Avoiding follow-up failure means that when you go out to a networking event, a chamber meeting, and you collect those business cards and you meet those people and you're shaking hands and looking people in the eye, I guarantee you there is no way you're following up with every single one of those people because they may or may not be important to you in the grand scheme of things when it comes to whether or not they're going to send you a new client. So take all those business cards in your purse that are laying on your desk, that are in your briefcase or your planner or whatever you have, get them out and put them into your newsletter system. Put their email addresses in there so that they are receiving an email every month from you. All of those leads that never closed, adult children of aging parents that called, they established a relationship with somebody in your office on the phone who tried to close them, but they didn't close because they just couldn't convince their mother it was time, or they couldn't convince themselves that it was time for home health care or home care, and or they went with somebody else and maybe they're not happy now. So anytime you put somebody on that newsletter list and you remind them, hey, we're here, we're still here to serve you if you need our help, you can request us, And when you do things like that, then your revenue goes up because those people will communicate with you. It may not be everybody, they may not open every newsletter, but they will communicate with you at some point. And many of them will say, you know what, either we're not happy with our current services, or we should have pulled the trigger 6 months ago and we didn't, and now she's fallen and she's had hip replacement surgery, she's discharging from rehab. We know we've talked to you in the past and we want your help. Analytics traffic goes way up when these newsletters go out. So you see little spikes in the number of people visiting your website if you do this every month. And communication goes way up. People hit reply and they want to know more, or they want to talk to somebody. This is an example of a newsletter. This is actually the Home Care Daily newsletter, and you can go to homecaredaily.com to see that. You can subscribe to it if you want, but this is what I'm talking about. This is what I'm talking about. When people receive this newsletter, they are not interested in reading long dissertations, and maybe the Florida Home Health Aid accused of stealing from clients, maybe that is no point of reference for them and they have no desire to read it. But Mayo Clinic Ending Home Health Services in Alberta Lee may be something they really do want to read. So people can scroll through this newsletter on a mobile device. They can hit the highlights, they can hit the headlines, or the read more text there, and they can move on with their day. And they're driven right back to our mobile responsive website. So if you want to see what that looks like every week, it comes out once a week, you can go to homecaredaily.com and sign up for that newsletter, and you'll see it's very simple, very easy, and it even comes out in a text version too. Social media, all the accounts you don't need and the ones that make the most sense. So along with your newsletter, you need to make sure you have your content from your website, all those blog posts, going out to LinkedIn, Facebook, Pinterest, and Twitter. And some of these are more important than others. So LinkedIn and Facebook are going to be your top two accounts in home healthcare. LinkedIn.com is your professional to professional networking. You should make sure that your profile is fully filled out, that you are representing your current place of employment or the business that you own, and you're representing that properly. You want to join groups that are local to you. They do not have to be home healthcare groups or even healthcare groups for that matter. But join a few of those, plus join some chamber groups or some meetup groups. There are lots and lots of people in this world who have aging parents and may not be in the healthcare world. So make sure you join lots of different groups that are local to you and be sure to participate. You can always sit on a Sunday night while you're watching The Walking Dead or Game of Thrones, and you can get on your laptop or your iPad or even your phone, get on LinkedIn and reach out to people that you haven't been able to connect with otherwise. All you got to do is put a search in for their name. You're probably going to find them if they've been in the professional world for a while, and you can just send a connection request and maybe a little note to say hello and that you've been trying to reach them or something like that. Just something simple and pleasant, nothing too overwhelming. But you can turn those online conversations into offline meetings if you work it right. So LinkedIn is your professional to professional networking. Facebook is your community outreach. You should have a Facebook business page that is done correctly. You should create a group off of your Facebook business page. You can join other groups that are for networking or for your local community, and you should participate. Your Facebook business page needs to have as many fans and followers as humanly possible. So what we do for our clients is we make sure they have 1,000, 2,000, 3,000 fans on their Facebook business page. And once they hit those kinds of milestones, it's easy for us to create a support group on their Facebook business page. That Facebook now allows you to create those groups. People will see posts from a group faster than they will from your Facebook business page. So it's super important that you create that group, that you participate with it, that you encourage other people to participate and share their stories and to support each other. Facebook is definitely the #1 community outreach platform for home care. Here's some examples of what posting your content looks like. So the very top arrow says that this links back to content they have written on an authority site. So in other words, this is a client, and the article, the bottom of that article that you see there at the very top is an article that they wrote, but it's on a different website. But that's very cool because you want to have your content on all kinds of different websites. And then the next article with the fiber is essential for a senior's healthy diet, that links back to the client's website. So if you were to click on that and read more, then you would go right back to their mobile responsive website. And then the last one down there at the bottom also links back to their website. So home care in Cary, North Carolina, activities, something to brighten up your winter. I can't see it all, but those are links back to their website. That's why it's important to blog post and send that content to Facebook as opposed to always just posting on Facebook. Now here's someone that is just posting little cute memes, and that's fine to have some cute stuff out there, but it links to nothing. So it doesn't do their website any good. So it's okay to have this stuff, but you want to mix it up with the stuff we have in our slide previously, which is stuff that links back to your website. Otherwise, Facebook is doing your website no services at all. So you want Facebook to work for you. This type of outreach is okay as long as there is a mix of links back to your own website too. This by itself will do nothing for your website, and it will make no difference. So keeping that to just mixing the two up and making sure you have both blog posting that shows up on your Facebook and some cute stuff is super important. Pinterest. For our clients, we set up a Pinterest business account, and we search engine optimize not only the account, but also the URL of the account and the board name of the account, and then we pin all of their blog posts to their boards inside their Pinterest account. This is not a place where you're going to get a client, but it does help with backlinking. It does help with web savviness. It does show people that you're keeping track of what's going on and that you are a resource. So Pinterest for business is a great opportunity. One that I didn't talk about, I'll go back to my slide here, is Twitter. Let's go back one more. Twitter is important to have, but it is not a place where you need to become an expert. So if I had to tell you the top 2 accounts in this list, it would be LinkedIn and Facebook. Facebook being number 1, LinkedIn actually being number 2. Twitter is great. If you're a tweeter and you already have a million followers, then that's totally awesome. But if you've never used Twitter, you're never going to get a client in 280 characters or less. So it's not worth getting crazy about. It's great to post there, automate posting from your website to your Twitter account. You don't have to touch it. You can just have your blog post go straight there and automate that. So let's go back. Search engine optimization for hospice is different, and for home health care. So search engine optimization for home health care is different. SEO, keyword phrases you must know in your market. Does your service provider know your market? So what we have found is that in the home health care market, a lot of our clients will come to us from a general practitioner in search engine optimization, and they will have search engine optimized or made an attempt to search engine optimize the client's website, and a lot of times they're using keyword phrases that are incorrect. So as a general practitioner who doesn't work in the home healthcare industry, if I went to Google and I asked Google, what is the most searched for keyword phrases, or what are the most searched for keyword phrases for home healthcare or home care? Google would tell me that the top 2 are home care jobs and home health aides. And I will tell you that although that information that Google spits out is correct, it would be the incorrect thing to do for our clients and for you, because you do not want your website to be optimized for home care jobs and home health aides. Those are keyword phrases that job seekers are typing in. They are not keyword phrases that your consumers are typing in. Consumers have a huge range of keyword phrases they type in because they simply don't know what to do and they don't know what to look for. So it's really important that you have that unique, fresh content coming into your website every week that covers all those crazy long keyword phrases that people type in when they're not sure how to address their issue. So home health aid and home care jobs are not the phrases you would want to use to search engine optimize your website. So here's a bit of a recap. Step 1, you want to make sure your website is professionally representing you well. It's designed for lead capture. It's optimized for your local area. It is mobile responsive. It has clear calls to action in different places. It has unique weekly content in the form of blog posts. And it may be a tracked phone line for return on investment, so you can track those phone calls and you can track those forms. You don't have to do the tracked phone line, but it does help. Step 2 is making sure you do have an SEO keyword plan. Here's a sample. It's prioritized by geography and by keyword phrase. It's used to help search engine optimize the core website, and it's used as a guide for, in our case, for our weekly blogging that we do for our clients. Continuous content publishing, you also want to make sure your blog posts are going up a minimum of once per week. They are 100% unique to you and not shared with 300 other franchise owners or 300 other people, or are copied from the New York Times. A minimum of 400 to 500 words. You need to optimize for your top keyword priorities. Feed blog posts to social media automatically and to your monthly newsletter automatically, so you can set it and forget it. Publish local company news like your people, events, your celebrations, your co-hosting, co-sponsoring, hosting, charitable organization support, all those things. Put those on your website as blog posts, and they will automatically go out to your social media. And then publish articles with your key referral partners. If you do have some non-competitive referral partners or marketing partners, like maybe your home health company partners up with a DME company, or maybe you don't do IV infusion, but you do have someone else in the world that you like to market with who does the IV infusion for you. You could always write articles about their services and put them on your website, and in turn they could do the same for you. So you can always highlight a service or a resource in your area that's helpful for seniors and their families. Step 4 is engage through social media. Your Facebook is your community outreach. Your LinkedIn is your professional networking. You want to feed content from your blog to all your social media. You can boost your important posts, but there's a caveat to that. You want to make sure they have a call to action. Invite everyone on your email list to like your page. Use Facebook paid ads to build likes. We definitely do that. And publish testimonials. You have an automated monthly e-newsletter. That would be awesome. It will increase your revenue. It should be fed from your blog, and you need to build the best email list in your territory. All of your prospects, potential referral partners, and clients. Publish quality information regularly. Articles, company news, employee celebrations, testimonials. It keeps you top of mind, and it builds engagement with your local audience. Step into some authority offsite publishing and backlinking. So we have a complete suite of websites that are national and local to our clients, and we publish content for them on those websites that links back to their original website, and that helps build backlinks and show you as an authority and a trusted expert. Reputation management, we didn't hit on this a whole lot in the main part of the conversation here today, but we're going to talk about it now. So building trust with reputation management. This can be tricky and can be hard for some home health care agencies, but you do need a high volume of positive testimonials. You need to try and eliminate or correct negative reviews. And you should be using a third-party site for credibility. So a lot of you will use Google My Business, or you use Yelp. I'm not a big Yelp fan because Yelp is for places that you check in. It's more appropriate for restaurants and entertainment venues and places like that. For you all, Google My Business is a nice one. We have one called Senior Service Reviews that we use, and it helps you because it lets you decide which reviews go live and which ones are privately taken care of and addressed by staff or by management. Anytime you have a review, you should also make sure it gets to Facebook as long as it's positive, and distribute it to your prospects. So this is a really nice, and Senior Service Reviews is our, we own that. You don't have to use ours, it's just an example, but as many reviews as you possibly can get is important. SEO management, tracking, and reporting. If the person you're using for SEO isn't doing this, they need to start. So I think you need a keyword plan. They need to show you where your keyword phrases are showing up on the first page of Google, second page of Google, third page of Google. You should have a tracked and recorded phone line and some performance consultations. For franchise owners, a lot of you are part of a franchise. There are solutions for business owners who cannot change their website very much. You can have content on Facebook. You can use authority sites, social media, reviews, and newsletters. If you can't blog post, or you can't access your true website for adding new content, you can work around that by using your social media to help you. Here's a great question we get a lot. I'm friends with a guy or gal in my local chamber group who does SEO and websites. Should I use him or her? And I would just answer the question this way. You need to ask that person a lot of questions. Have they ever worked with a home health care agency? Do they understand the needs of the adult child of the aging parent? Have they personally experienced any elder care issues? Are they going to provide weekly content that is unique? Do they have access to elder care authority sites where they can post articles for you? And do they really know what keywords are correct for home care? It's not just the word home care, and it's definitely not home care jobs or home health aid. So what about Google AdWords? We get asked about that a lot. I think there's an 80-20 rule here. I'm not a fan of Google AdWords for the home healthcare industry or home care private duty industry at all. I believe that if you spend $1,000 a month, our research has showed us that 800 of that will go to job seekers, and 200 of that per month will go to people who do need services or help, but many of those people will not qualify. They will be Medicaid recipients. So you're throwing money out the window. I would never recommend AdWords for a home health or a private duty home care agency. There are Facebook programs for home health care. If you're interested in any of those, you're welcome to reach out to us at 888-404-1513. If you don't have time for blog posting and Facebook and all that stuff, we would be happy to talk to you about that. We have hundreds of clients that we provide unique content for every month, and we help them with not only their content, but their social media, their e-newsletters, and many other things, reputation management and authority sites, tracked and recorded phone lines, and SEO keyword tracking. So if you do need help like this, there is help available, and you can talk to any one of us on our team about how that works. And we'd be happy to point you in the right direction if we're not the right service for you. Our website is ltcsocialmark.com. The phone number is 888-404-1513. My business partner is George Novison. He can help you at george@ltcep.com. And you can contact him for instant pricing and information and a smart conversation about your real needs versus your budget versus doing nothing at all. And just be sure to give us a call if you need anything. These are some of our, just a few of our testimonials. There are probably 46 or so on our site if you go look at that. And I thank you very much for listening and for learning more about social media and how to generate leads with online marketing for home health care. Thank you so much, and we'll talk to you soon.